sponsors. Are you a family caregiver? Are you caregiving for someone who can no longer take care of themselves? Are you overwhelmed? This is Caregiver Solutions Info with Marcia Teele. Marcia will be hosting an hour of true stories and information, tips and updates of the latest research and necessary information in the caregiving field, focusing on you, the family caregiver. An Alzheimer's disease and dementia care expert, Marcia has 15 years of hands-on experience at Arden, Quartz, a leader in assisted living dementia communities here in the U.S. Marcia covers everything you need to know as a family caregiver, especially if you care for a loved one with Alzheimer's disease or other related dementia or chronic illness. If you have a friend or relative that is also a family caregiver, call them now. They won't want to miss a minute. And let them know they can watch on caregiversolutions.info. And they can listen on WNN 1470 AM in South Florida or nationally on the iHeartRadio app. Now, sit back, relax, and learn from our host, Marcia Teele, as she brings information to you that may just be the caregiving solution you need.
Good evening, everyone, and thanks for joining us on the Caregiver Solution Info Show. I'm so glad that you're here. We have another great program for you today. This show is for caregivers, for unpaid family caregivers, caregivers who are caring for someone with some form of dementia. It might be Alzheimer's, it might be vascular dementia. It doesn't matter. It's all memory loss. And it's really difficult because it's something that we don't plan for. No one teaches us how to do it. We're usually thrown into it unprepared. Another thing that I see caregivers are very unprepared for is as they go through their journey and they're learning about dementia, about the behaviors, the characteristics, how their loved one is changing, what they have to do to help them, to take care of them. They're watching these changes. They're seeing their loved one decline week after week, month after month, year after year. Actually, Alzheimer's disease has been dubbed the long goodbye because a piece of your loved one is actually dying every single day. And you're seeing them disappear before your eyes and you're saying goodbye over and over and over again. A piece of them just you're losing every single day. But eventually the time comes when you're going to lose them totally, physically, forever. And that is a really hard thing for anybody to process. But because you're waiting and you're watching, it's really important to know what's going to happen and how do you prepare yourself. A lot of families don't have time to prepare for the death of a loved one. Sometimes it's sudden and they weren't even able to say goodbye. But when you have a cognitive disease like Alzheimer's that is just slipping away very slowly, sometimes in stair steps, on plateaus, different ways that it progresses, it is a goodbye. But you can prepare for that so that at the end it will be not that it's easier, it'll never be easy, but that it will be more of an understanding for you and bring you more peace. So today we're going to be talking about that and how do you prepare and what happens when someone is getting toward the end of life and what can be done to help them and to help you as the caregiver. So I have two special guests today. They are from the Trust Bridge Hospice and Palliative Care, Palm Beach County, and I'm happy to have them joining me virtually. We have Christine, and she's in the upper right if you're looking at your screen. If you're on the radio, she's the beautiful lady there, and she is Christine Hernandez. She's a facility liaison with Trust Bridge. And then on the bottom, we have Jacqueline Lopez Devine. We can call her Jackie, and she is the Chief Clinical Officer of Trust Bridge Hospice and Palliative Care of Palm Beach County. Welcome, ladies. Thank you for joining the show today.
Thank you, Marcia. Thank you for having us.
So I just want to start out first and foremost because, there are caregivers born every day, and that's because people every day get diagnosed with a cognitive impairment, right? And the caregiver has to step up and start taking care of somebody. So they don't know what they don't know. And so we're talking about hospice today, and hospice sometimes can bring a negative connotation to somebody if they don't know what it is and what it can do. They sometimes think hospice, oh, what's that? And, that's for, people that are ready to go to heaven in 2 days. So we're here to educate people, to give them the information that they need so that they can be confident in knowing what they need to do and their options for their loved one toward the end of life or as they are progressing in that direction. So, my first question, I'm going to direct it to Christine. What exactly is hospice and what is palliative care, and are they different?
So I use the word palliative when I'm talking about hospice, but hospice care is when you've had a critical change where you're finding that maybe going out of a hospital is not really the answer for you, but you do want extra support. So it's coming in, it's wherever you are. So hospice care can be in your home, it could be in a nursing home, it could be in assisted living. We meet wherever that person is, and it's giving that palliative comfort care.
And so, the word
Marcia.
palliative, what does that mean? Do you want to explain that a little bit, Jackie?
The way that I get people to connect, if I think of a textbook, the label of that textbook is called Palliative Care, and there's various chapters within that textbook. One of the chapters for end of life is hospice care, but palliative care, it could have pain management as a chapter, it could have various different chapters, and what we focus on is a segment of symptom management and end of life care.
Okay, that gives a good visual, good analogy. I can picture that book. That is a very good explanation. So, when someone is talking about hospice care, they're including palliative care as part of that, right? It's part of what you do within the hospice services to make
Yes.
somebody more comfortable, right? It's palliative, it's making them more comfortable as they go through what it's actually the dying process. Um, so, Jackie, how long have you been in the hospice world, and what are your medical credentials?
I've been actually working for hospice for 16 years and with Trustbridge all of those 16 years. I'm a master's prepared nurse with a specialty in neurology, actually, from the National Institutes of Health.
Wonderful. And so, to you, Christine, we introduced you as a facility liaison with Trustbridge Hospice. What exactly is a facility liaison, and what are your duties in that job?
So a facility liaison specializes in assisted living and skilled nursing home facilities. So I'm the person between the facility, our Trust Bridge team, families, physicians, education. So I'm kind of um, the piece that builds and everyone together to make sure that the processes and from start till the end of life are, sorry about that. My saver, my office just turned off. But the end of to that person, we're there for them through the whole process. So sometimes I'm meeting with families initially, and I'm actually giving them the education of what we really do in hospice care, and it's in the nursing homes and assisted living.
Okay, great. So you mentioned before that people can receive hospice services pretty much anywhere in a nursing home, in assisted living, at home. You said wherever they are, you go wherever they are. Are the services the same or would they be different depending upon where someone is located, Christine?
Well, if they're in a skilled nursing facility, then we would be helping with the team that's already there in the facility. So we're that extra layer of care. If it's a private home where there's a caregiver, then we are in conjunction with the care of the caregiver. So we are with our team. We consist of a physician, a care manager nurse, a CNA, a chaplain, and a social worker. So that's the main part of the team that we're going and seeing that patient.
So there are teams assigned to different facilities. Uh,
Mhm.
Do those same teams also go into the home? You have the same people that would be a part of that team into someone's home also?
Every team is a little bit different. I do have some teams that only specialize in the home, and then I have other teams that actually are in the home, assisted living, and nursing homes. So they go to all of them. So it kind of depends on the zip code, the location of where that team is.
Okay, great. So both of you have a lot of experience. Jackie, you want to add something to that?
Yes, we thank you. Yes, we try to design the care model so that it's zoned for prompter response. So that's why some of the teams are combination and some of them are specifically for either homes or facilities. It's all about trying to do the best response time to the patient or the caregiver that needs our help.
Yeah, that makes sense. Really, it does. So both of you have been in your positions a long time with hospice, 16 years, 10 years, and you've talked to hundreds of families, I'm sure, from the get-go, from the beginning. Like Christine, you said you're educating people. And I'll throw this out, let you both have an opportunity here with this one. What are some of the misconceptions that people have before you were able to educate them and explain to them what hospice is and does? What have they told you they thought it was? Anybody want to share some stories or comments about that?
So the
So
initial, oh, go ahead, Beck. Sorry, Beck, go ahead.
that's okay. That's okay. I was going to say the top two that come to mind first is that hospice comes in, gives the last lethal dose of morphine, and that's it. That's what they do. And the reality is, we do symptom management, and we try different types of medication that deal with pain control. That's an example, or respiratory distress. And we try to do a lot of education, but there are some myths surrounding how we manage care. Our goal is simply to treat a symptom and arrive at comfort and dignity. And then the other biggest myth is that hospice is like for the final days.
Right.
Quite frankly, the breadth of the benefit, it's a 6-month benefit. And as Christine identified, the main caregivers in our interdisciplinary group model, but we do other things. We do music therapy. We have a robust foundation that allows us to do some extraordinary care measures. So, it's difficult if you just are there for 3 days versus the full breadth of the benefit, which is 6 months. And we can go in and invite other interdisciplinary group members to help with the psychosocial and spiritual needs as well, besides the medical. Christine?
Uh,
Yes, and I love being part of that initial conversation, especially in my facilities, especially when family maybe they're out of state and they hear the word hospice consults being written, because a lot of people fear that that means there's something that's critically an emergent reason to come flying down. And most of my facilities I've worked with for so many years, they know when it's really appropriate to bring us in, because we're finding that once we get those symptoms under control, if it's pain or whatever, they're breathing, their quality of life really goes up. So a lot of times there is a panic, and we want to make sure we're in open communication with the families. And then when they go on our services, they see all the benefits and they're like, "Wow, I wish I would have done this sooner." I hear that so
Right.
often. I wish I would have done this sooner, because they didn't realize the extra layer that they're getting in the facilities, but also just the quality of improvement with how we're able to specialize on those critical illnesses. And that's why I'm here. I mean, I feel like it's really a mission.
There's one other myth that we can't forget, and that is I'm going to have to let go of my primary doctor because hospice
Right.
will not allow me to be followed. That is absolutely not the way that it works. We actually partner with the primary care physician. If they want to continue to be following the patient, we embrace that. If not, and the primary doctor wants our hospice and palliative care certified, board certified physicians to carry on, we will. So that is one of the biggest misconceptions, even amongst clinicians.
Hmm. Yeah, good point. I hear that too. I talk to a lot of caregivers, and I even, you know, do my little spiel about hospice, and, help promote them to call you all so that you can help them even further. Because when they hear that word, sometimes they just cringe, or they gasp, and it's like, what, and because they really don't understand. So we're here to help everybody and get them on the same page, and get those misconceptions straightened out so they know what they need to know. We're going to take a quick break, and when we come back, we're going to hear more of hospice care from Trust Bridge with Christine and with Jackie. So stay with us. We'll be right back.
Feelings of depression, isolation, and frustration are common among persons living with Alzheimer's or related dementias. It's common among those who care for them, too. It takes a lot of patience and courage. It also takes knowing when you can no longer do it alone. At Arden Quartz, memory care is all we do. Talk to us. We know. We understand. We can help. Don't let guilt keep you from making the right decision. Visit arden-quartz.com. Arden Quartz follows equal housing opportunity guidelines.
You are listening to your host, Marcia Teele, an Alzheimer's disease and dementia care expert on caregiversolutions.info. If you have a question or wish to share a story, call into the show at 888-565-1470 and talk with Marcia. Now, back to Caregiver Solutions.
We're talking about hospice today, and we have two special people joining us from Trust Bridge Hospice. We have Christine Hernandez and we have Jackie Lopez Divine, and they are awesome people, work for Trust Bridge 16 and 10 years, and they're sharing their expertise about some of the misconceptions that people have about hospice, and giving you the things that you need to know and setting the record straight. So right before break, we talked about when people hear the word hospice, they sometimes think that, oh my gosh, does that mean my loved one is ready to pass away, right? And we know that that is not true. So that being said, Jackie, when should somebody think about contacting hospice? What would they need to know? When is it time? If they thought, like Christine said, I should have done it sooner, what are some of the criteria that maybe a loved one caring for someone at home should look at and then think about, is it time for hospice?
Okay, great. So I like to do things so that I can remember them for the future. So it's a list that I call the 5 F's. The first is if there's changes with feeding. So there's weight loss, progressive problems swallowing, maybe somebody who has a history of aspiration pneumonia. So really feeding, weight loss, very important. The second F is function, changes in function, maybe somebody who's lost their ability to care for themselves, and they require total assistance with their activities, and maybe they're completely bedbound and they can't get out of bed. The third F is called frequent events. So if you're frequently landing in the emergency room because of problems, infections, problems chronically, hospitalizations, you've had falls, or frequent visits to the hospital. The fourth F is failing systems. So overall, you've got wounds, they're not healing correctly. You've got your lab values are not correct. There's a gauge, and this might be a little bit more technical, and I'm sorry, I'm a nurse, but albumin level, that's a real critical factor that we look at. If that is low, below a certain factor, that's really important. We gauge a patient's progress that way. If someone has metastatic cancer, that generally that is a very, very good indicator that you're eligible for hospice. And then the fifth F is called feelings. Someone who's been diagnosed with a terminal illness, and the doctor, the patient, the family, they themselves feel like, I have a life limiting illness. Generally, a good time to ask the doctor, am I an appropriate, or is my loved one an appropriate referral for hospice?
Okay, the 5 F's. So if someone had a few of those, would they be eligible, or do they have to have all five, or is it a case by case? How do they
So I
determine if the person?
So, Marcia, I would say it's case by case because it's a lot of it is driven by the diagnosis that someone has. So, in a diagnosis like Alzheimer's, we're going to look at the complexity of the Alzheimer's themselves, and maybe any other diagnoses that they have. It was somebody who's got a metastatic type of cancer. It may just be that alone is sufficient. So, my guiding direction is really, it doesn't hurt to ask and call us. And Christine at the end will give you the number so we can have a conversation and just start by really looking at the history and looking at the patient's case and seeing how we can help you. Sometimes it's just even, we act as referring and connecting you to other help before you even land in hospice.
Well, that was a great segue to my next question, which I'm going to ask Christine, because how are the referrals generated? Do you have to have a referral from your doctor, Christine, or how do hospice services get started? What's the process?
The normal process would be that a physician might bring it up to a family, but families can also bring it up to their physician or even just call our number to start having that conversation. It's physicians sometimes, if they may not have the time, or they're still waiting to do some other testing, they like for families to bring up hospice care because it is something that, I mean, I've been in this county now for over almost 11 years with the physicians, and they like it when the families approach the subject because then they understand that they really know what hospice can provide. So it starts that open gate to have that conversation. People are always welcome to also just call our admissions to inquire, and then we can have that conversation started. But either can come from their physician or they can actually call us directly to start the conversation.
Okay, well, that's good to know. So people, if they feel that maybe this is the time and they really want to ask questions or give you that information and talk to somebody about their situation, what is that number? Just in case somebody's just wanting to write that down right now, Christine.
The number is 561 5140.
Okay,
The
so if
local number.
someone is listening to this and you have more questions, you want to go ahead and make that phone call, it doesn't hurt, right? It's not ever too soon. Like you said, Christine, people sometimes wait too long. I mean, has anybody ever really waited too long?
People wait too long a lot. The physicians have really started to welcome hospice, especially even during COVID. It seems that because a lot of people were so fearful of going in and out of the hospital from their home, wherever their home was, and they really weren't getting anything done within the hospital. They were maybe doing some labs, but nothing was really changing. So it brought the conversation um, forward more during this pandemic that we've gone through to make people feel more comfortable knowing that they don't have to leave their home to have treatment. And as far as with Trustbridge, we've been around for 40 years and we're also nonprofit. So a lot of the people in the territory are now very familiar with who we are. And when you do call it missions, you're getting people that are really trained on the conversation. So it's not someone's going to take a message, it's someone that has that time to spend 20, 30 minutes or how much someone needs. So we're here to support them throughout the whole process. And you can never, I always tell people that I talk to, you can never call too much, or you can never have too many questions because I feel that knowledge is power. So you can never have too much.
Thank you for that. Jackie, I wanted to ask you the flip side of that question to Christine was, do people wait too long, before they actually initiate hospice services? The flip side to that is that some of us have actually heard that people have been on hospice services for maybe months, even years. How is that possible?
So everything is done by eligibility and criteria that we look at. And I talked about sometimes it's even, lab criteria that we look at and not just the progression of the normal disease. And the research studies actually show, Marcia, that with hospice, sometimes life expectancy has grown, it has expanded. And I believe that is the great care of the team working in collaboration with the private caregiver, because it's more than just physical treatment of symptoms. Christine described beautifully the care of the team. That is a psychosocial, spiritual component. And that is an added benefit in hospice that's not necessarily seen in all aspects of healthcare. Um, but what I'd say is, there is a small percentage of patients that are discharged. They actually improve. They were admitted when they were acutely ill and they were at death's door, and with treatment, with follow up, they then get discharged. It's a small percentage, but it does happen.
So they go on hospice, and because of the services they receive through hospice in conjunction with the rest of the team, their medical team, they actually get better, and they we call it, they rally. They're not on death's door anymore, and so now they're no longer eligible for hospice services. So later, when they decline again, can they go back on hospice services, and how many times can they do that, Jackie?
They can definitely go on, and honestly, there's no rule in terms of how many times, as long as the eligibility criteria is there. I'd rather people think about the fact that, we got discharged, we provided the training needed, and when they got sick again and really looked and appeared to be in their last days or at the end of life, that they get referred right back to us. And that does happen. Sometimes it happens. I mean, I've seen patients revoke several times, and a lot of it depends on the age and the type of diagnosis, family dynamics. There's no wrong and right. We're not here to judge. Everybody's situation's a little bit different. Our team is just there to help people try to accept the reality of what's going to happen.
Great, thank you. So, Christine, a question for you. You all are in Palm Beach County. Do you service other counties, or is hospice county by county within the state or within the different states? Because I know we talked a little bit before the show started. There's about 5,000 different hospice organizations throughout the United States. That's a lot. So there's different ones in different states. But if somebody is on hospice in, say, one county in Florida, and they're going to be moving from North Florida, let's say, to South Florida, can they transfer services? Do they have to go off of hospice and then reapply in a new county, because it is zoned, so to speak, county by county? How does it work when someone is already on hospice and then they move?
So, Trustbridge, to answer the first part of the question, Trustbridge is in Palm Beach County for over 40 years. We have been also in Broward County. So we're now in two counties, the nonprofit hospice. We do have, because we're seasonal, we do have people that transfer. Some that even transfer up north and then come back. So you can go from, let's say, Tampa on another hospice and coming to transfer to Palm Beach on Trustbridge. So we do transfers quite frequently. And then sometimes if they're coming in for their family members locally, or they also need help with placement into facilities, we're able to help with that whole process to get it as smooth as possible.
Great. So because you guys are a referral source for other things that they might need also. That's
Correct.
Wonderful.
And we try to help place that person with those, if someone is coming into Palm Beach to be in a facility, to place their personality with the correct facility. And being as large as we are in one county, we actually have our own pharmacy and our own DME. So we're able to get the equipment that's needed very quickly, and also all of the medications that would be needed as well.
Wonderful. That's great. Well, we have to take another break, and we're going to be thanking our national sponsor and be giving away a book. So get a pen and a piece of paper, and you'll want to write this down if you'd like to get a free book. So we'll be right back after this short break. Thanks.
Arden Quartz is not just a place to live, it's a place to call home. Residential living combined with quality caregiving. This is the philosophy behind Arden Quartz. Communities created exclusively for individuals with Alzheimer's disease and related dementia who would benefit from a safe and structured environment. For additional information about any of the unique services Arden Quartz provides, call 888-478-2410 to locate a community nearest you. Inquire about our educational seminars, resource library, or support groups, or simply feel free to ask questions you may have about Alzheimer's and related dementias. At Arden Quartz, we know, we understand, and we can help because memory care is all we do. Remember, call 888-478-2410 for additional information about any of the unique services Arden Quartz provides. You are listening to your host, Marcia Teele, an Alzheimer's disease and dementia care expert on caregiversolutions.info. If you have a question or wish to share a story, call into the show at 888-565-1470 and talk with Marcia. Now, back to Caregiver Solutions.
I'd like to take this opportunity to thank our national sponsor, Arden Quartz Memory Care Communities. Arden Quartz is a memory care, assisted living community for people that have memory loss, because memory care is all they do. And not only do they take care of the residents that have memory loss, they're there for the family caregiver. That's you as well. And one of the things that they love to do is help caregivers. And today, because you're listening or watching this program, they'd like to give you a free book. This is called the 36-Hour Day. It's a wonderful resource for family caregivers dealing with dementia. Lots of information, lots of tips, lots of definitions. And if you don't have this book, I highly recommend it. All you have to do to get it is send an email with your name, address, and telephone number to delray at arden-quartz.com. That's DELRAY at Arden, ARDEN -quartz, COURTS.com. So send an email today, delray at arden-quartz.com. Tell them that you heard about the free book, The 36-Hour Day, on the Caregiver Solution Info Show, and they'll be happy to mail you the book. So I am so happy to have my guests here today. They are from Trustbridge Hospice and Palliative Care. They serve Palm Beach County and Broward County here in South Florida. Christine Hernandez is the facility liaison. And we also have with us Jackie Devine, and she is the Chief Clinical Officer, being that she's an RN and has a master's in nursing, and she is talking all things from the clinical point of view. And we're getting lots of great information from Christine about hospice services within a nursing home, within assisted living, and within your home. So this is like so good, ladies, a lot of great information. I wanted to ask you, since we're talking about things provided, Christine, what does hospice cost to a person?
So most of our patients that we have are covered under Medicare or Medicaid. We are a nonprofit hospice, so even if there is not a payer, Trustbridge will take that patient. We do take Blue Cross Blue Shield, so it also kind of depends on what insurances that they have, but we give care to everyone.
So you don't have to really be disenrolled from something to get on hospice care. In other words, it's an add-on to what you currently have.
Correct. If they have a Humana or any type of HMO plans, it goes straight back to Medicare. It doesn't affect those plans. And I always tell everyone that when you go into our services, if for some reason you're not happy, you do not have to wait a 30-day period. There was some, I don't know where that has come, the misconception of that, but if someone goes on our services and they aren't happy, it never happens, but if they weren't happy, they could disenroll immediately. So it's something that they don't have to wait a certain period for their insurance if they decided that they do not want to have Trustbridge services.
Great. That's good to know. I know someone that was a big question. Well, if I'm on an HMO or if I'm on a PPO and I'm with, I have a plan that's not Medicare Advantage plan. Do I have to go off of that, get on straight Medicare in order to get hospice services? And the answer is no, you do not,
No.
because those services are provided through your insurance, what you already have. So that's another great piece of
Right.
information, which is, some things that people don't even sometimes think to ask. And that's why we're asking all the right questions. So we talked about hospice and what it does and when someone should maybe consider it. Um, is hospice ever thought of as a good thing? Uh, and in other words, why would someone embrace hospice? What can I know you take care of the person, you make them feel better, but what other benefits would hospice services provide not only to the patient but to the family? And either one of you could maybe answer this because you've been by the family side for many, many years and many times. So how does it help a family?
So I always tell
So,
everyone because go ahead, sorry.
oh, that's okay, Christine. Go ahead.
I always tell the families that it's not just for the patient; it's for the entire family. Because the social worker has a big part of dealing with the family and what their needs and concerns may be. So it's navigation of care for the whole entire family. So we're there for everyone.
And so, I love research and I love data. And so there was a research study done, and it surveyed several hundreds of physicians. And that the results of that study kind of solidify why hospice is so important. So, a couple things: 88% of doctors said they want their, based on conversations they've had with their patients, they want doctors to be honest with them. And we're always going to be honest. Our team's trained to be honest. They're trained to have these difficult conversations. 81% of their patients wanted their loved ones around them. That's the model that we promote in hospice. 76% wanted to be at peace spiritually. Well, we have a whole discipline really focused on that. We have chaplains, we have several rabbis on service with us as well, who can provide expert spiritual care. And then certainly, we don't promote giving up hope. And in this study, 46% of patients wanted to live as long as possible. So we really, we're going to be right there wherever, as Christine said, wherever that patient is. And it's not just physically, but it's emotionally and spiritually as well.
Great, thank you. All right, now I'm going to get to something a little more difficult. It's hard to talk about, but it's the actual dying process. And someone goes on to hospice and they get the team in place and they're receiving the services from the doctor, the nurse, the social worker, the clinical part, the spiritual part, from the rabbi or the minister. So things are in place, but obviously there is going to come a point in time when the body is just going to break down and the person's going to pass away. And like you said, Jackie, most families want to be there with that person, and they
Mm-hmm.
sit and they almost wait, and sit and wait and sit and wait, and they don't want to leave their side because they want to be there at that time of passing. It's very difficult. I've seen families do that, just waiting. I feel so bad for them. And so some of them are surprised, and don't understand what they're experiencing, right? Because no one has maybe explained to them what to expect. So, from a clinical point of view, um, I would like you to explain the dying process of what a person who is on palliative care, what they're going to be going through, and what a family should expect to see, if you don't
Sure,
mind.
sure. No problem. So just to kind of keep it succinct, okay, so the system's slow. Everything slows down in the system. You're going to see a patient doesn't want to eat as much. Most patients, they're literally spending the bulk of their day in bed. It's not uncommon for them to say that, they don't want to be bathed, they don't want to, get dressed. In terms of pain, sometimes we'll see that pain increase. Some people, they're blessed. They quietly go into a sleep and, we just manage what we call the facial grimacing, and we look to see if we need to medicate them. Um, but you will see some patients that experience pain. And so that's the specialty. The specialty is really looking for the subtle symptoms so that we can manage whether it's pain. Sometimes you'll see respiratory distress, depending on the type of diagnosis that the patient has. And we do have medications to treat the respiration changes. Sometimes you'll see increased secretions, and we have medications to treat that as well. We'll talk about changes in skin, turgor, and skin coloring. And, we actually have a whole booklet that we give families, that pretty much goes into detail about these symptoms and about these changes. I just did a very high level, but the breadth of what we can do is much more extensive. If we're there with you and it's in person, these conversations really need to be in person because they're difficult conversations to be had, Marcia.
Absolutely. Um, One of the things that I remember, a hospice nurse who was bedside, I mean, I want to talk about crisis care too, but she said something about looking to see if the skin was mottled. Can you explain what that means?
Yes. So you're going to see changes where there's color changes in the skin. Also, the skin looks like when you press it, it stays pressed and it doesn't bounce right back like with normal healthy skin. You press it, you don't even notice that I've pressed it. But if I press someone whose their systems are slowing, it's going to stay depressed. And you'll suddenly also see some discoloration changes as well. Um, so we try to prepare by talking about these symptoms, and you can see it in different parts of the body. Um, yeah,
Okay, another. These are hard questions, and but
it's okay.
they're life questions, right? Um,
Yes.
Sometimes families say, I was there when he took his last breath, and they talk about the last breath. Um, they talk about they went peacefully, or in some cases, they gasp for breath. Is it different for everybody?
My experience, it is different. You can see patients who have a respiratory, type chronic illness when they get admitted, and they might have even more increased need for symptom management for respirations. And then you see some patients, as I've mentioned before, respirations may not be the most complex symptom that we're dealing with. So it is very individual. We're very equipped to deal with the different medications needed for that. But, the bottom line is if anyone has a question or, and they think that their loved one may be getting there, just give us a call because this is what we specialize in, those types of symptom management issues. And respiratory is one that is really scary for families at the bedside. And we have a team of professionals that are there 24/7 to answer the phone. We can deal with something like respiratory distress. Certainly we can send our nurses out, but a lot of times we try to prepare the families that want our help to be able to manage those symptoms. So whether it's that's more of a private home setting. In a facility, it's about working with the team members there at the facility. And so bottom line is very, very individual in response to your question about what we see and how to manage that.
Absolutely. And I know that, and people do have a lot of questions. The reason I brought some of those questions up is because I don't want caregivers to be afraid to ask those
Right.
questions, right? We
Absolutely.
want them to be comfortable asking those questions so that they know what to expect, that they're comfortable, that they're not surprised. So I brought up the topic because I know that, it's not always easy for a family member to ask those kinds of questions, but obviously you all are educated and prepared to answer those type of questions. So I want to, encourage caregivers that if your loved one is on hospice, ask the questions because that's what
Thank
you're
you,
there
Marcia.
for.
Absolutely.
One
And
more
it's
question I have for you. You mentioned 24/7 crisis care. What's the difference
Okay.
between regular hospice care and crisis care?
Okay, so it's a conversation I have frequently, not just with clinicians, but caregivers, right? So the difference with crisis care, patient is someone who is eligible for hospice, but has a symptom that we've tried to control with either some medication, and that those attempts have failed. And so now we need to escalate the care that's required. And so, it's called a level of care. It's called continuous care. We actually call it crisis because I think families remember that, oh, it's to deal with the immediate crisis. And minimally, it requires that a nurse be in the setting for 8 hours to deal with that crisis. And bottom line is we can go hour by hour for a complete day, but sometimes we'll just be in there to deal with the crisis. It could be as short as 8 hours. We manage the symptom, we walk away. We might come back the next day to do a visit and see, wait, you need a little bit more help. And we come back and start that crisis care again. So it's really about what we see when we go in. The other level of care that I do like to talk about, because actually our facility partners sometimes need us to do this, is so there's 4 levels of care: routine home care, that's just, nurse visit, that whole team that visits and cares for that patient in the setting that they're in. There's the continuous crisis care that I'm describing for an acute symptom, that not just dying, an acute symptom like pain or respiratory distress. There's respite. If the caregiver needs relief for up to 5 days, we can actually provide respite support. And we've done that, with facilities like Arden, where we've contracted with. We've had patients who come from home into the facility for respite care. And then last is we have 7 care centers that people call them hospice houses. And sometimes in conjunction with Arden Court, when there's a case that may need more intense care, with Arden leading the conversation and talking to the patient and the family, we may see that the best thing is to temporarily move this patient until we can manage the symptoms and they can return back to their facility. That's not an uncommon thing.
Yeah, good to know. Thank you for explaining all that. We're going to take a quick break and we'll be right back.
Somewhere at the corner of bewildered and confused is a lost mother, a father, a sibling, a grandparent. Wandering is a common symptom of Alzheimer's or related dementias and can often make those who care for a loved one feel just as lost. If you're looking for a place that's safe and secure, look to Arden Quartz. Memory care is all we do. We know, we understand, we can help. To learn more, visit arden-quartz.com. Arden Quartz follows equal housing opportunity guidelines.
You are listening to your host, Marcia Teele, an Alzheimer's disease and dementia care expert on caregiversolutions.info. If you have a question or wish to share a story, call into the show at 888-565-1470 and talk with Marcia. Now, back to Caregiver Solutions.
We're back, and my special guests are from TrustBridge Hospice and Palliative Care of Palm Beach and Broward County here in South Florida. And with me today is Christine Hernandez. She's the facility liaison for 10 years with TrustBridge. And also Jacqueline Lopez Divine. She's the Chief Clinical Officer, being an RN, Master's in Nursing, and she's been with Hospice for 16 years with TrustBridge. And you ladies, I know you have a heart for what you do, and therefore you're there a long time. And when we love what we do and we're helping people, it doesn't feel like work, right?
right.
Correct.
So we talked a lot of things about hospice and what it does and what it can do. And so basically, Christine, I'm going to let you end our show with a few words about why, just speak from your heart, because I know that's what you do best. Why should somebody consider hospice services if their loved one is failing? And then end it with telling everybody about how to contact TrustBridge, maybe give a website and a telephone number.
Well, first I want to say thank you so much for allowing us to come on the program. It's been an honor, and I always tell families that you can never start the process too early. I always feel like if you wait too long, then the quality of the days, you might lose some of those. And that's, in each person, it's different. So if someone has some pain that's not being controlled, or breathing, like Jackie had spoken about. So I've seen our team nurses and our clinical physicians just being able to really manage symptoms that are when someone's in a critical state. And I worry about people that don't have hospice at end of life. I feel that everyone should have that part, because we all come into the world and we're all going to leave the world at some point. And I feel that everyone should have that piece. I have a good friend that's a pediatrician, and when I was on the St. Mary's team, it was hard because it's, you're dealing with younger. And she said, well, what if we didn't have hospice? And it's true. So I feel like it's a really important part of the medical system, and I feel that everyone should have that piece, not only for the symptom management for that patient, but also to support the family. And when they do leave us, we have a wonderful bereavement department, so they're able to really have group. There's some individual. Now with COVID, it's changed a little bit, but if you go onto our website, trustbridge.com, you can see that information about all the support that we offer. And people that even haven't had hospice, we have bereavement support for the community. So I feel that we're a very good part of this community, and I do believe in what all the clinical team and it's that they do, and the honor it is to be able to be part of it. So, but we do have a great website, trustbridge.com. Our admission number is 561-227-5140. But we're here to help and support the community, and I feel that we really do that. And it's a beautiful thing, like you said before. It's not just a job, so it's a passion.
Yeah, it really is. Well, I want to thank both of you for coming and spending some time and explaining and educating caregivers, and even some professionals. They don't know all the ins and outs, and they deal with geriatrics, and everybody needs to know and be on board with having that conversation, because it is a conversation that needs to be had at some point in our lives to make quality of life to the end of life, right? I mean, we can all have some a little bit more peace and quality even at the end, and that's all what anybody would actually wish or hope for. And so thank you all for coming. I appreciate you. Keep doing what you're doing. Take care. God bless. And if you're a caregiver and you want more information, please reach out to trustbridge.com, and they'll be able to help you with any of those questions you might have. Also, don't forget, every Tuesday, 6 to 7 p.m., Caregiver Solution Info Show, and you can watch us live at caregiversolutions.info, or catch us on the iHeartRadio under WNN every Tuesday, 6 to 7. So until then, have a good evening. Wish you well, and I'll see you next time. Have a good night, everybody.
Thank you, Marcia. Thank you.
Thanks for joining us for this week's Caregiver Solutions with Marcia Teele. Join us next week as Marcia, who has 15 years of Alzheimer's disease and dementia care experience, brings you more needed information to help with the care of your loved one. This show can be seen again on caregiversolutions.info, and questions can be left on the site, which may be used on the program to help others. See you next week for more Caregiver Solutions.